Passing AMC Part 1 on your first try is every international medical graduate's dream. But here's the truth. It's not just about how hard you study, it's about studying the right way and with the right resources. Today I'll walk you through the 5 best books and resources, actually a total 7, that have helped countless doctors succeed. And along the way, I'll also share practical tips so you can avoid common mistakes and maximize your preparation. Before we open the first book, let's understand what makes AMC Part 1 so unique. AMC Part 1 is a computer-based exam with 150 multiple choice questions. Every question is rooted in real-life Australian medical practice, so your preparation needs to be laser-focused. General medical knowledge isn't enough. You need to know how to think like a safe, competent doctor in Australia. The resources I'm about to share are exactly what will help you do that. Let's start with the most essential tool straight from AMC itself. The AMC Handbook of MCQs is the official question bank from the Australian Medical Council. It's your closest simulation of the actual exam. The format, the style, the level of difficulty, everything matches. The book doesn't just test you, it trains your brain to think the AMC way. My advice, don't just solve it once, do it twice. The first time to check your knowledge and the second time to deeply understand why you got certain questions wrong. But to answer questions well, you first need strong clinical reasoning, and that's where your next resource comes in. The Anthology of Medical Condition is another official AMC resource, and it's a game changer for clinical reasoning. It links symptoms to conditions in a structured, logical way, helping you master differential diagnosis. Many AMC questions are not about giving you the answer directly, they are about seeing if you can reason your way to it. Practice reading each case and saying your thought process out loud. This will train you to be both fast and accurate under exam pressure. Now, even though AMC Part 1 is an MCQ exam, physical examination skills still sneak in, and that's where the third resource shines. Talley in O'Connor's clinical examination is a classic in Australia. It teaches you the fine details of physical science and examination techniques, the kind of details AMC loves to test subtly. My tip is not to read it cover to cover, instead focus on high-yield systems like cardiovascular, respiratory, abdominal, and neurological, because this comes up often in the exam. But AMC Part 1 also tests you in pure clinical medicine across all systems, so you need a solid theory base, and that's where our next book comes in. Davidson Principle and Practice of Medicine is a trusted book worldwide, and it's perfect for AMC Part 1 because it organizes medical knowledge system by system from cardiovascular disease to endocrinology. It gives you a clear through foundation while studying. Keep a dedicated notebook for topics you struggle with. Those will be your golden revision notes for the final month. But remember, the AMC isn't just about hospital medicine, it's about practicing in the Australian community. For that, we need an Australian perspective. Murtagh's general practice is uniquely Australian. It teaches how medicine is practiced in the community, from preventive screening to managing common presentations in GP clinics. This is critical because AMC often frames questions in a general practice setting. I recommend highlighting all preventive screening guidelines and common presentations. These are AMC's favorite. And of course, no doctor is complete without safe prescribing skills, and AMC Part 1 tests that too. That's where our next 2 resources are lifesavers. The Therapeutic Guidelines or ETG are Australia's official prescribing rules. They cover which drugs to use and in which situations. More importantly, they teach you to choose the safest, most effective option, which AMC loves testing. Don't just memorize the recommendations, understand why one drug is preferred over another. And if the ETG tells you what to prescribe, the next book tells you how exactly to do so safely. The Australian Medicine Handbook is your prescribing safety net. It lists drug doses, interaction, and contradictions in detail. I suggest using it as a quick reference tool, especially for high-risk drugs like anticoagulants, insulin, and antibiotics. This kind of knowledge can easily save you a few marks in the exam. And that's it for the video, guys. I hope you liked it and found it informative, and if you did, please press that like button and subscribe to our channel for more such content ahead. If you have any doubts regarding the AMC exam, please list them on the comments below. We'll be very happy to answer. I'll be seeing you in the next one. Till then, bye bye.